Secure Care provides a number of services across the community and inpatient settings. The future of Secure Care is exciting for us all as we prepare to move to Northgate Hospital in the spring of 2023. This move will see the completion of a new medium secure unit covering both mental health and learning disability services. All of the Secure Care at this time will be on one site. With this brings a number of exciting development opportunities for staff. We will have additional mental health wards as well as an enhanced care area, some of which will be open prior to 2023. The growth of Secure Care services allows us to provide ongoing, safe, effective care to our patients closer to home, supporting recovery and allowing our carers to be fully involved in the recovery of their loved ones.
I was attracted to a career in Secure Care from my experience during a placement when I was at university. I found that the nature of the environment kind of gave an opportunity for me to be as creative as I possibly could be in terms of providing opportunities for patients.
I've worked in Secure Care for over 10 years now, and it's where I came when I first qualified in psychology. And I think what appealed to me was the variety of the work that I was able to do.
I've done other things in my working life, worked with different kind of client groups, and for me this is the most challenging but the most rewarding.
So it's a good thing, it's a rewarding job, and I will encourage everyone who's out there who's looking to go into nursing or nursing assistant. It's a good thing, it's rewarding, though it's challenging, but it's the best you can give to people to get back on their feet again and see them well again and be happy.
So within Secure we have a very wide range of MDT professionals. We have lots of different experience and skills within that. We have ranging from doctors to social workers to teachers to occupational therapists, lots of different professionals working within that team. So every approach we have comes from all different angles, which obviously makes it the best for the patient that it possibly can be, and it's not just one-sided. We are able to kind of offer such a wide variety to our treatment.
Absolutely love it. Very passionate about what I do, and really for me that tiny little improvement with somebody who you're there to care for in a supportive team actually makes a massive difference, and that's really why I do it and why I love what I'm doing.
See, I think I'm lucky. I think I'm doing the best job in the trust, but don't tell anybody that. It's taken somebody who might not have been engaging in something, from spending a lot of time in the bedrooms, getting them sort of engaged in activities to a point where eventually they don't need you anymore. So that might be taking the guys down to a gym or a community setting, and then stepping back from that role, and then hearing a phone call a few months later that they're doing really well and they want to do some qualifications or something.
I think you have to problem solve quite a lot, and you have to pull in lots of different experiences you've had and different knowledge you have. So for people who like problem solving and who like to be really challenged in the way they practice and really creative in the way they think about working with patients, this is a brilliant place to be.
I really like the idea of being able to support people through their hospital stay to get them back into the community and making sure that they still had those skills that they came in with, and enabling them to continue to have those skills so they were able to use them again when they got back in the community. The
support you get in Secure Services is actually through the roof. You know, you're going to be kind of walked through everything. You'll never be left on your own. You'll always be supported.
I would say my manager, she's fab, she's lovely. I bump into her office all the time, knocking and say, this is what I'm struggling with. She will stop whatever she's doing and attend to me, so the support system is there.
I guess life isn't always straightforward, and there's been times where I've needed extra support, and I've always felt that's been provided. And obviously the opportunity to apply for my nurse training is a massive thing for me. And from the minute I asked to apply for that training, I've felt very, very supported.
If you've got the right passion and the right drive, you can pretty much move up, down, left or right within the role.
I've really felt like I've been able to develop and grow.
We've got lots of opportunities for lots of different disciplines, for registered and non-registered nursing.
So if you are someone who shares our values, including being caring and compassionate, we can support you from application to interview. Get in touch or pop along to one of our recruitment events for more information.